the top three because these are the ones that you're actually potentially could be exposed to or come in contact with in your job. So looking at this first one, so the first one, is this alpha decay or beta decay? Because both of those we've talked about. It's alpha, and how do you recognize it? That helium, right? So see the He as the product? That's really the trick for picking this one out. So alpha decay is when the nucleus of an unstable atom literally shoots 2 protons and 2 neutrons out of the nucleus. So it like comes shooting out, like literally out of the atom. And so that means that it's going to drop its atomic mass by 4, so the new mass would be 218, and the atomic number would drop by 2. Those 2 protons that come out lower the atomic number, so this would now be 86. So remember what happens then to the symbol. Is it still Ra, which is radium? Now it's what? Rn, which is radon. Okay, so that is a difference. That is the change that occurs. But notice now it's a smaller atom. It's a little bit lighter. Mass of 4, it's decreased. And that's going to help it to get a little more stable. Radon's also unstable. It's going to go through another round of decay, another round of decay. Every time it does, it gets a little smaller, a little smaller, a little smaller. And eventually it'll get to the point that the atom's going to end up being stable. So that's kind of really the goal of radioactive decay, is to take these atoms with too many protons and neutrons, reducing the number so that it becomes more stable. All right, but really picking it out, if you see the helium as a product, you know it's alpha decay. I'm not going to ask you to finish the reaction, like finish the products. I'll just show you a reaction and ask you which type it is. Okay, so then the second one, how do you identify the second one? It's beta. Why? Because of that electron. So you see that the E is a product, the electron is a product. So remember I told you this is when a neutron in the nucleus of an atom actually splits into a proton and an electron. So in doing so, the electron gets shot out because electrons don't stay in the nucleus. Electrons end up getting shot out and then they're part of the orbital, but the neutron then becomes a proton. They both have the same mass, so what happens to the mass? Stays the same. So that's still going to be 42 because you converted a neutron to a proton, so the mass doesn't change. But now I've added a proton to the nucleus. So what happens to the atomic number? Does it go up or down? It goes up by 1, right? So it's going to go from 19 to 20. So now it's not K, which is what? Potassium. Now it's calcium. So look on the periodic table, see atomic number 20. That's calcium. So this can cause an element to transform into another element. Remember, it's that atomic number that determines what the element actually, what its name and symbol would be. So here's the last one. So the last one is when you start off with an atom that it's unstable, that it has, like if you look at this one, this iodine, remember that this would be 53 protons, 53 electrons, and this would be 50, 60, 72 neutrons, doing the math in my head. All right, 72 neutrons, a lot of neutrons compared to protons. Remember that typically makes an atom less stable. When you have equal numbers of protons and neutrons, that's not so bad. But when you start getting a lot more neutrons than protons, then you start having these unstable atoms. So this one undergoes what is called, the third one, it's gamma decay. So gamma decay, they use this funny looking symbol. It's a gamma symbol. Okay, when I draw it, I almost always make it ending up looking like that. But like the font that I use, it looks kind of like a Y or kind of like an 8 sort of shape, okay? But in this, gamma is really the energy that's released when protons and neutrons shift around inside of the nucleus. So I've got 125 subatomic particles in this dense little core of the nucleus, and so they are kind of shifting, and that shifting causes a release of energy, and that's gamma decay. But they'll oftentimes write it with a 0 and a 0 because there's no change in atomic mass, There's no change in atomic number. There's no particles released. It's just energy. Okay, so this really just represents the energy that's released by unstable atoms as they're trying to adjust their protons and neutrons. So there's no change in mass, atomic number, or symbol. So that means that this iodine 125, which is what I would call that because it's an iodine with a mass of 125, you would write it exactly the same. The easiest way to recognize this one, it looks exactly at the beginning and the ending. Sometimes they'll have a little asterisk. So do you see how that iodine has that little like star next to it? It's a reactant. That's just to show that that's the more energized compared to the product. So sometimes they'll put that little asterisk. It doesn't really indicate much other than the fact that it's just a little different in terms of energy. And so that gamma symbol is really just indicating this energy that gets the release. Okay, so gamma, in all honesty, is the most like something you're more familiar with, which are X-rays. So if you're going to go into dental hygiene, you're going to work with an X-ray machine. If you're going into vet tech, you're going to have to be in the room holding the animal while the X-rays are taken. Okay, if you're going to end up being a nurse, you're going to be sitting outside waiting for them to finish an X-ray. And if it's a kid or a baby, you may end up being the person actually holding them still while X-rays are taken. So X-rays, they're a lot like a gamma ray. So they are really energy waves. But X-rays are not produced by a radioactive substance. So X-rays are produced by shooting a high beam of electrons, really like electricity, at certain metals. So they found that some metals, when you shoot electrons at them, that they become energized. And when they become energized, they release energy in a wave. And so tungsten is the most common metal that they use. So the tungsten metal, when you shoot electrons at it, that metal becomes energized and then it releases an X-ray. So X-rays have a lot of power. X-rays have enough energy, these energy waves, they're strong enough that they can pass through soft tissue. So that means they can pass through your skin, they can pass through muscle, they can pass through those soft ventral body cavity organs like your liver, spleen, GI tract. The only thing that's going to block them is things that are solid. So in your body, the most solid things are your bones. Okay? So they found that if they exposed a body part to X-ray waves and they put a photographic film on the opposite side, the film would get exposed everywhere except where those solid bones would be, which made it really helpful if somebody had a break in the bone, right? So if you had a break, some kind of injury, damage, that, because it's cracked, there will be fluid in that area, and so the X-rays will pass through that area, exposing the film on the other side, whereas areas where the bone is solid, it wouldn't. This actually suddenly allowed them to identify fractures that before they would have had to do surgery to identify. So they would have to cut into you and open up and go, oh, look, it's broken. Okay? Like that would be the only way they would know, other than the fact that like your bone's sticking out through the skin. Like that would be pretty obvious. But if it wasn't sure, then they wouldn't actually know. So they could identify and then know for sure, yes, we need to immobilize the bone because bone will heal itself. It will actually heal that damaged area. That's why you end up in a cast, so that bone recycling can occur, fixing itself. They can also then see if that fracture is bad enough, if there's lots of pieces in the area, they might have to go in and do surgery and put pins and screws, holding things together a little more fixed for a period of time so that it can heal itself. It'll still heal itself, but depending on the damage, that helps them to identify what happened, okay? How bad is this injury? Will it fix just with casting or is surgery required? Okay, so that was really the big plus. So in this, they started using X-rays. The first X-rays were really like done in the early 30s, because remember, this all started out right around 1900. So about 1925, 1930, they started developing, okay, we got an X-ray machine, which was pretty big, and we have photographic film, which actually had to be developed, like old photography film had to be developed, so it all took time. The amount of energy you had to be exposed to expose the film was 100 to 200 times more than what you're exposed to today. So as time has gone on, film has gotten much more sensitive, so you don't have to use as much energy to expose the film. So now, like if you've gone to the dentist to go get your bite wings or to get the full panoramic X-ray, the length of time that you're actually exposed to this energy is extremely short, like thousandths of a second is all that's required. It's like that's it, okay? Whereas it used to be like, like it used to be long. People that were using a lot of radiation, a lot of X-ray techs, like through the 60s and 70s, they were exposed to large amounts of radiation. As an X-ray tech today, it's really, really low levels because we have digital film. And digital film is the most sensitive in comparison to those original films. But digital film's nice because you can actually do some contrast techniques with it. So you can brighten or dim, you can make it sharper or a little less, and you can actually see more like layers compared to like a film used to just be a piece of paper, right? And so you can't really see depth with that. So digital technology and with X-rays has really changed it a lot, okay? But this is like a gamma ray, okay? So gamma rays and X-rays are really like the most comparative. So why are you concerned about radiation? So this energy, when you're exposed, whether internally, externally, like through your job, it would typically be an external exposure. So if you're working in and around, any type of radioactive energy can end up affecting living cells. So if you look, they call this energy ionizing radiation. Ionizing radiation can change molecules inside of living cells. So it could cause cells to not function as well. It could cause cells to create tissues like scar tissue more than it should. It could cause cells to die. It can cause enough damage to the machinery of the cell that the cell can't survive. Or, worst case scenario, besides cell death, is that it might cause a cell to begin growing faster than it should. And that would be what? That's a characteristic of cancer cell, right? Cancer cells lose control over cell growth. They grow faster than they should. They lose that cell cycle control. So that's really the concern if you're working around any form of radioactive energy being released, is you want to minimize your exposure because you don't want any of your body cells to end up with those negative side effects. Okay, so ionizing energy or ionizing radiation, this energy can cause changes to molecules within living cells. That can cause a cell to not work as well, right? So it might not grow as well, or it might not produce what it needs to do as well. It could cause that cell to die, but it can also cause a change in the growth of the cells. So cancer cells, a characteristic of cancer cells is that they grow without control. So ionizing radiation could cause damage, mutations, are typical words that are used, and that could end up affecting the functioning of your body cells and end up leading to a disease, end up leading to cancer. So because of this, in your job, you want to make sure that you shield yourself. You want to make sure that you are minimizing your exposure to any type of ionizing radiation. Ways that you do that really depends on the kind of radiation you're talking about. The three, the alpha, beta, and gamma X-rays, they actually have different penetrating powers. So alpha, which is that big helium nucleus, big particles don't usually go very far. So in fact, alpha decay, the particles, if you are more than a few inches away from a source that's emitting alpha particles, then you're fine. So it doesn't usually, those particles don't go much more than a couple of inches. Okay? So they can actually shield this or protect it just by putting a piece of paper, a thin aluminum, putting it in like a cardboard box. That would actually shield it, so you wouldn't be exposed to that radiation. Beta, though, remember the little neutron to a proton, that energy, that has, it's a smaller particle and has a further penetrating power. So beta energy has the ability to penetrate into the skin, so it could affect the epidermis, the surface layer of the skin, down into the layers of the dermis. So it doesn't go all the way through, but it does have the ability to penetrate into cell layers. But then look at gamma and X-rays. Gamma and X-rays, they have the highest energy. They have the most penetrating power. So we already said that X-rays pass straight through soft tissue. Gamma rays as well. So the only thing that really stops X-rays is bone. Gamma rays, nothing really stops it. You have to use like lead and concrete in order to be able to block it. So the highest energy would require the most shielding for you. So here's what they typically do. So they say alpha can only go a couple of centimeters, so like this, okay? So just a cardboard box would be plenty. That would protect you. If you're working around something that would be an alpha emitter, so a radioactive substance that was releasing this energy, you would still wear a lab coat. When you wear scrubs, scrubs are typically a heavier duty material than just a general t-shirt. And so that thicker layer of clothing, you would wear gloves if you were handling it, because gloves would be a protection from it having any effect on your skin. Goggles, if you were working up close with it. But again, remember, it's not going to go much further than this. But that's just to safety precautions, normal safety protective shielding you would use. Beta, you would need more. So they would typically, we used to use beta emitters in grad school. So we always kept them, they were always kept in a plexiglass box. So plexiglass is like, if you've ever been to the Hurricanes hockey game or seen a hockey game, you know the glass that covers the rink, and it's like ½ an inch thick. So that's what we had, is we had like plexiglass shields in a plexiglass box, and so all the isotopes were kept inside of the box. And that way, even if you're walking by, it's shielded. It's keeping it away from you. Whenever I would use it, there was a plexiglass shield, and the sample was always kept. And you would wear gloves, and you only use what you would need very short term. Heavy duty clothing, again, so plexiglass, heavy duty aluminum foil, you know, like the heavy grilling foil that they have, not like the cheap foil, but the thick stuff. You could use that as well. So it can't get through something that's like pretty sturdy like that. But then when you're talking about gamma and X-rays, which is really the X-rays are the ones that you're exposed to the most, X-rays, when you have to hold an animal, hold a patient, have to be in the room, what do you end up doing? Yeah, you have it, and it's not just like a small one. You have like the whole lead apron, right? So it's this lead apron that you like throw it up, it covers over the top of your shoulders, and it comes all the way down to mid-thigh, because that's going to help protect all those vital organs. So a lead apron is an appropriate shield that you would use. If you're a dental hygienist, do you like stay in the room when you do those bite rings? What do you do? Well, you actually go where you stand, where the button is, the wall that shields you is actually a thicker layer, like it's actually OSHA requirement that they have a layer of either a layer of lead in the wall, or they have a layer of concrete. So they have to put like a concrete block up. And that means I'm going out, I'm hitting the like electrifying the X-ray machine in order to take the X-ray itself. And that's that protection for you. So that's typically like if you're a radiology tech, if you're working with adults, all you tell them is like, okay, hold still. And you see that they walk out and you hear that the little buzz. So that's that extremely short period of time that X-ray even powers up, and then an even shorter period of time that it ends up being in use, but that's going to protect you. So all X-ray rooms have either concrete wall barriers behind the drywall, so that way like the people in the next room aren't being exposed, or there's like a lead layer. Okay, so that's all in that protection. So they didn't do all of this before. They didn't do all of this in the 30s, 40s, and 50s. In fact, at one of the when they first developed X-rays, one of the World's Fairs, so World's Fairs, people used to come from all over everywhere to go to the big fair in different cities. And so, like, when this first came out, they were like, have your hand X-rayed. So people were getting X-rays of their hand. It's like, wow. So you could actually see your bones. And so the people were getting, and the amount of energy that you were exposed to under those conditions, like I said, was hundreds of times more energy than what you're exposed to now. So those are the reasons. Now, if you have a patient and they have to have an X-ray, what do you do in terms of shielding the patient? Okay, so you don't oftentimes use a complete apron, but what do you always try to put it? Why? Right, so you always want to at least protect here, because here, these are those reproductive cells. Okay, so you want to protect the ovaries and the testes, because radiation that might possibly cause damage to developing egg and sperm could end up leading to mutations that affect offspring. So that's really the reason why they're like, you know, they always ask, are you pregnant? No. Okay, well, here, put this on anyways. Okay, doesn't matter. They're still going to do that. That's always a protection. Another new one, though, that they have found is that X-ray techs were actually having a higher than normal incidence of thyroid issues. So your thyroid is actually a gland. Remember, we talked about it. It takes up iodine. It's an active gland. It helps to regulate metabolism. So the cells in your thyroid are always active. So they have adjusted the shape of the aprons. So you either wear like a little neck cuff, or the big aprons the techs wear if they have to be in the room. You'll notice it comes up higher. So it almost looks like it has a standing collar thing. That's really why, is because they're trying to protect your thyroid as well, because they saw that people that were doing this for years and years and years, they had a hot slightly. It wasn't huge, but it was enough to make some more safety decisions. So all of those things, like taking those seriously, making sure that you're protecting yourself and protecting your patient is really important. I literally just sent IT a thing saying, hey man, I need you to do something for me. Like, I need a new computer. Because my old computer didn't do this. The only way to get this to stop is I have to end, and then I have to come back, and then I have to go back to display, and sometimes it kicks me off. Good. Yeah, and now it'll work and be fine for 15 minutes and do it again. Okay? So the amount of your exposure in general, you're exposed to cosmic rays. So there's rays from outer space. There's energy from the sun. So you're exposed to ionizing radiation anyways. Limiting that, there's some things you can do. Sunblock, like, helps to block some of the ultraviolet rays, which can have an ionizing effect, give you a bad sunburn. But they do say that most of our, like, unnatural exposure is because of medical procedures. Okay, so they estimate about 40% of your 40% since the 80s, and it's because you end up getting, like, if you think your bone's broken, they're going to do an X-ray. Okay, and then there are things like a CT scan. So have you heard of a CT scan? So a CT scan is really where they take hundreds of X-rays from different angles, and then a computer puts it together so you can get almost like a 3D view. So that way, it's like you can see the arm from this side, this side, this side, this side. So it actually allows you to see all surfaces. So that's what a CT scan, it's really just a 3D X-ray. But it may end up taking hundreds of X-rays, and then the computer puts it into an image. These are really good for being able to pick up very small differences. If you have, like, if there's blood somewhere, that's going to look like a clot. And so that'll be thicker than blood that's free flowing. And so by doing a CT, you can actually see those areas that it might have more water or less water in them, and be able to pick up injuries like after a car wreck. So a CT scan of their chest is going to look for, like, broken ribs, but it'll also look for, like, blood in the lungs or blood in the thorax, or if there's fluid collecting around the heart. You can see that because areas where there's a lot of liquid kind of shows up as a different color. It's less dense than or more dense than areas where there's less liquid. Okay, so that's really the only difference between an X-ray and a CT scan. X-ray is just a single film. CT scans are where they do lots of X-rays from different positions, and then that's going to then give you a three-dimensional view. So, interesting thing, in the 1940s, they actually used to have X-ray machines in shoe stores. So the X-ray machine, so like see the little kid standing up there, the X-ray machine was in the bottom of this little platform. You would climb up there, they would turn it on, it would take an X-ray of your foot with your shoes, and it was their way of showing them that it was actually your shoe fit correctly. Okay, so that was pretty much 1950, the Nuclear Energy Regulatory Commission was started. So they started like looking at how radiation was used and their effects, and this was like sort of like shut down because they're like, this is not necessary. In fact, this may actually end up causing problem because you don't want to expose somebody to energy if you don't have to. So this was like sort of done as more like a gimmick rather than actually being helpful. So what can happen if you're exposed to radiation? Most of the time, the amount that you'd be exposed to, you would have no physical effects. You would not notice that you were exposed. Long-term low levels, typically not a big issue. So like if you were exposed to very low levels, like in your job over time, especially now with the shielding we do and with the very low levels of radiation they use in most of the diagnostic centers, the odds are really low compared to, say, the 60s and 70s. Those people had a lot more radiation exposure in comparison. But intense short-term dosage, so if you're exposed to a large amount of radiation, that can cause damage that the body can't recover from, that you end up finding disease developing, that you end up having cancer, those issues. So trying to make sure that nuclear power plants are doing what they should, that anything that is being any radioactive materials that are being used, that they're being stored properly, that they're disposed of properly, all of those are big issues. Now, not only are we talking about X-rays, but we use radiation as one of the ways of fighting cancer, right? So typically, if somebody is diagnosed with cancer, then they talk about treatment options. They're going to use radiation or chemotherapy. Okay, so radiation is using energy, chemotherapy is using chemicals, but the goal is going to be exactly the same. We are going to try and kill, we want to destroy rapidly growing cells. Because what is the characteristic of cancer cells? They are cells that grow without control, so they're growing faster than they should. And so radiation, the ionizing energy from radiation, can cause damage to those rapidly growing cells and then help it to shrink. So help stop it from continuing to spread, reducing its size. So that's always the goal, right? So the goal is we want to kill the abnormal cells. But the problem is you have a lot of normal cells that also grow rapidly. Can you think of any? Can you think of any cells in your body that grow pretty fast? Skin cells. So skin cells, people that undergo radiation typically develop rashes in the areas where it's exposed. They may have skin breakdown, so they may actually develop a sore. And that's all because of exposure of ionizing radiation to the skin surface. Sometimes they can just do what they call spot treatments, where they only expose certain parts of the body or a very small area of the body to that ionizing radiation. Sometimes they have to expose entire regions, so they may end up having like entire arm, leg, upper, lower torso areas. Sometimes they have to do whole body radiation, so that the person can end up, it almost looks like they got sunburned. So they can end up with this red rash, peeling type of skin because of damage to those rapidly growing cells. Think of another. Hair loss. Because the hair root, your hair grows about 1/2 inch a month. And so those cells are constantly dividing and forming the hair shaft as they get pushed up. So those roots get damaged, and the hair then stops growing and it falls out. What else? What else? Okay, well, discoloration would probably go along with the skin. Think internally. What other symptoms do people have when they're undergoing radiation? Nausea. So they have their GI tract. Most parts of your GI tract are replaced. The lining is replaced every 3 to 5 days, right? So the lining in your mouth, lining in your esophagus, in your stomach, small intestine, every 3 to 5 days it's getting renewed because it gets rubbed all the time, right? When you swallow food, it rubs cells so they get damaged, so they're constantly growing. So rapidly growing cells get impaired by exposure to radiation. And so this can lead to nausea, vomiting, diarrhea. It can even lead to malabsorption of nutrients. So because that lining is so irritated, you don't absorb nutrients as easily. So patients may end up having a hard time getting the nutrients they need while going through treatment. My mother went through cancer treatment. She was in her early 50s, and she said for about a year, everything she put in her mouth, it tasted like a penny. Like her taste buds, because your taste buds are replaced every 3 days. So her taste buds got all out of whack, and she was like, it's just like there's pennies in my mouth. So like it's all this weird metallic taste that she just had. It lasted about a year before it finally seemed like it was like it went away finally. But those are all those things that you think of seeing with a patient that's undergoing radiation or chemotherapy. All those side effects is because the chemicals or the energy that they're using is trying to target abnormal cells. But it also ends up having an effect on healthy, rapidly growing cells as well. So I thought this was kind of funny. So this is Marie Curie. Marie Curie worked with Becquerel, so she was in late 1800s. She was one that actually, she isolated and extracted radium. She named it radium because it glowed. So she kept a sample of radium by her bedside. It was like her little nightlight. But it was releasing ionizing radiation the entire time, where she ended up dying of leukemia. So leukemia is cancer of the white blood cells, and your blood cells are rapidly growing cells. So that exposure, that constant exposure, before they really understand what exactly this energy was and what exactly this energy could do, there was a lot of sort of trial and error things. So I just thought that was kind of funny, though. All right, so most of the stuff that we end up with exposure really low, they talk about exposure in millirems. So a rem is just a unit of energy. A Curie is another unit of energy that they'll use. But most of the time, we're down like in your lifetime, you're like down in here. You're not really exposed to very much. It takes an awful lot of exposure to get into those hundreds of thousands. But reading through some, like loss of pregnancy can occur because of high levels of radiation, can cause lethal damage to a developing embryo. That you can end up with the hair loss fatigue, like what you see in a patient that's undergoing chemotherapy, radiation treatment, can cause permanent sterility. So the story about this, sort of like the history lesson, in 1986, in the Ukraine, there was a nuclear power plant called Chernobyl. So a nuclear power plant actually uses a radioactive source, typically it's uranium, and they extract and they purify it. So normally uranium's in very, very, very low levels, like deep in the earth. So they like extract it, purify it, and then like develop it so that's now like a pure rod. This takes thousands of years to actually decay, but the entire time it's decaying, it's releasing energy. So the way that a nuclear power plant works is you have this radioactive source, and it's placed in like a sheath, which is kind of like an insulator. So it can be covered so that it doesn't always release energy. You remove the little sheath, the energy gets released, it heats water. So the heating of water will eventually boil. When it does, it forms steam. And so it's just like a steam generator. So steam, you know that water, when it becomes a gas, it expands, and that runs a little turbine, which then can be used to generate electrical energy. So we're taking nuclear energy, converting it to heat energy as a form of steam, and using that to actually convert it into an electrical energy. So like in Raleigh, there's a nuclear power plant. And so this one, like they're scattered all over the United States, all over the world. And under normal conditions, so this uranium is in like this really big pool of water. And they've got this little shield that can help kind of protect it and control how much energy it's releasing at any given time. So if you need more energy, you would like expose more uranium, make more steam, make more electricity. If you didn't need as much, then you could cover it some so it would release less energy at the water, make less steam, less electricity. So you could kind of like adjust it. So that's the normal thing. So here's what happens. And this is just like, there's millions of decays that uranium will end up having to go through. But in just this, you see uranium starts off, it goes through alpha decay. So see how its mass drops by 4, number drops by 2. So it becomes thorium, TH. And it releases some gamma energy. So remember, the gamma energy is the high energy. That energy is then transferred into the water that surrounds this uranium sample. The energy that builds up helps to run these steam engines, and that helps to generate electrical energy. But that thorium also then decays. So thorium undergoes beta decay, and then that undergoes another round of beta decay. So it actually reforms uranium, but it reforms uranium that's a little bit smaller. So notice uranium-238 at the end, we have uranium-234. So it's lost a couple of subatomic particles from the nucleus, but it's still got 234. So it's got a lot of breaking down that has to happen before it'll end up getting into the small enough size that it wouldn't be more stable. Because remember, we said more than 83 is pretty unstable. This one's 238. So it's going to end up having to lose over the course of time lots of particles out of that nucleus before it'll ever reach any kind of stable level. But all along the way, you get energy, you get energy, you get energy. So this energy that's being released can be used in generating electricity. So in 1986, what happened is they really hadn't been maintaining. This was a 25-year-old nuclear power plant. They had problems, issues with some of the sensors, trying to make sure that the water temperature was correct, trying to make sure that the little shield was correct. So they went through a test. And in the test, they like shut everything down. And so when they did that, the shields were open, the water got too hot, it generated way too much steam and literally blew the top off of the nuclear power plant. Okay? Like a big steam explosion. Okay? Because water, when it gets into steam, you start to develop pressure, and it developed so much pressure that it actually blew the top off. So then it's like the entire nuclear power plant was open from the top. That amount of energy caused uranium to actually split. And so into the atmosphere, you had unstable atoms like cesium-137 and iodine-131 spewed out into the atmosphere. So that means that now it trickles down, it's hitting water sources, it gets up in the clouds. They actually, so this is in Ukraine, they actually started to detect radiation in France. That was one of the first things they were like, something happened. Because our basal level of radiation, like all of our little charts are going beep, 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 beep. They're like, what? And the Russians are like, it's fine. Everything's fine. We had a small problem, but it's fine. And so iodine-131, if ingested, where does it go? Where does iodine go? The thyroid. Right? So that's one. So cesium can actually take the place of calcium. So cesium can end up in the bones. But iodine-131, when ingested, ends up in your thyroid. So just to show you, before 1986, on average, in this region, there was about 1 person per million that would develop thyroid cancer. Since then, the number in 2003, it was up to 60. So 60-time increase in thyroid cancer, and that's all because of that iodine-131 that was released in the atmosphere. So they said that like 12 people died, which I find really hard to believe. Okay, but again, this was back when it was like Russia and still like USSR, and they were like not very communicative, kind of like how China was with COVID, not very communicative, going, everything's fine, don't worry about it, everybody just has to stay home now. So same thing here, they weren't really upfront about it. They did end up having like an entire commission come back through and look at it, and it really changed a lot of the safety regulations at nuclear power plants all over the world. So, because they said this could be a global issue, like this was bad, but it could have even been worse, because where they lived, they basically evacuated 350,000 people within like a 80-mile radius of this nuclear power plant, and it's still very sparsely populated. People, the only people that live there now are the people that like always refuse to leave, like the old farmer guys that were like, no, you know, they were like not going anywhere. But there's towns that actually, you know, people that worked at this power plant, there were towns and schools that like built up around this power plant, and they're just like empty. Like there's just like apartment buildings and there's schools, and it's just like a ghost town kind of thing, because nobody's ever still, and this is how long ago? You know, 40 years ago, and it's still, people have not like been able to move back into that area. They're still higher than normal levels. They did end up encasing that whole reactor in concrete, but there's still that question of like, because that uranium will be there for thousands of years. Mm-hmm. Yep, so I think I have it. So uranium, the physical half-life, how long it takes for uranium to break in half, is about 4.5 billion years. So if you have a sample of uranium, it takes 4.5 billion years for it to actually go, so there's half of it left. Yeah, so pretty much like that area, pretty much nobody. That's pretty limiting. So those are just the things. The other thing, what time is it? Yeah, we probably can. You can measure the amount of energy that a substance is releasing. The most common unit that they use, sort of the metric unit, is called the millicurie. So it's MCI is the millicurie. And so there's a detector, so they have like Geiger counters. So they have machines that can actually detect energy. And so it can pick up just how much energy is coming from a sample. So you just set it next to the sample, and you can put it at different distances. Alpha decaying, you would have to get it really close. Beta, you could have it a little further away. X-rays, you wouldn't have to have it anywhere near. It was, as long as it wasn't behind some kind of shield, it would be able to pick up the amount of energy that was being released. You can determine how much energy is there and how much energy remains after periods of time, because different unstable atoms break down at different rates. And so they have identified what they call the half-life. And so the half-life is exactly that. So if I have 100 millicuries of, say, iodine-131, and it takes 2 weeks for it to break down, in one half-life, how much would be left? So if I start off with 100, and it's one half-life, it'd be 50, right? So in one half-life, there would be 50 millicuries. So that is the amount of time for it to break in half, to have half the amount of energy. So I always just say, just divide it by 2. So what if I had 3 half-lives? What would I have to do? I would start off with 100, and in one half-life I'd have 50. And then in 2 half-lives I would end up with 25. And then after the 3rd half-life I would have 12 and a half. So each half-life, all I do is just divide by 2. So the amount of energy in a half-life would decrease by 50%. So that's why I say, just say divide by 2. Divide by 2. Divide by 2. So it's just a matter of just making sure that you do that. Medically used radioactive substances, unlike the one where I showed you with uranium, the ones that you use in medicine, so we use radioactive substances in medicine, you might use them for a diagnostic test as an external source. There are even internalized sources that you would use, but ones that you use in medicine typically have a very short half-life because you don't want to expose the patient to more than is absolutely necessary. So if you look like chromium-51, it's like 3-4 weeks. Looking at iodine-123, only 12 hours. So in 12 hours, half of that would be gone. So if you were going to do any kind of testing with the patient, you'd want to use the lowest possible emitter, so the lowest possible activity, and you'd want to use one that has a very short half-life so that in a half-life, half of that energy is gone, and then another half of that energy is gone, so that it basically breaks down quickly. That is kind of the goal. So in this, if you're going to determine half-life, the steps to doing this, always first, you want to know how many half-lives you have. And the second is just do the math, right? Every half-life, you just divide the amount by 2. So if I have a patient is injected with iodine-131, and so this is commonly, this one's a therapeutic isotope, so it has a longer half-life that effectively damages and destroys an overactive thyroid. So in some cases, people's thyroid, maybe that there's abnormal cells within their thyroid. Maybe their thyroid is just super overactive. They have hyperthyroidism. If they can't control it with medicine, instead of having to surgically go in and try to cut it out, they can treat them with iodine-131. So they give you an injection of iodine-131. All the iodine in your body goes right to the thyroid. So that means no other glands, no other tissues are affected. But it is then going to sit in your thyroid and release this ionizing energy and cause damage to cells that are active. If your thyroid's overactive, you're going to start to see thyroid cells begin to die over time. So if a patient is injected with 150 millicuries of iodine-131 and the half-life is 8 days, how much remains in 32 days? So first step, how many half-lives is 32 days? 4. Right? So how did you figure that out? You took 32 days, right? That's the time period, and divide it by the length of time for the half-life. So I know I have 4 half-lives. So I'm going to start with 150. 1 half-life, what do? Divide by 2, right? So divided by 2, and that's going to give me 75. So that's 1 half-life. I got to do this 3 more times. So the second one, just divide by 2, and you're going to end up with 37.5. That's half-life number 2. Do a third one, and then a fourth, okay? So I'm just going to divide my number, divide by 2 each time. So then this one is, and then I'm going to do it one more time. 9.375 millicuries. So that's it. So it's not terrible. It's just a matter of remembering, 1, you'll be given your half-life and you'll be given a time frame. So then you just take the time frame divided by the half-life, and that way you figure out how many half-lives go by. And then for each half-life, you need to take the amount you start with, divide it by 2, that amount, divide it by 2, that amount, divided by 2, till you get to an answer. You're leading me right to it. So now, last thing, you look back at your numbers. How many significant figures in 150? 3, because see the decimal place? I did that on purpose. So 3 significant figures. How many significant figures in 8.0 days? 2. How many significant figures in 32 days? 2. So look at your measured numbers. I'm going to have to round to 2 significant figures. So what would I put my answer as? 9.4. Exactly. And it's MCI. Okay? Just follow those steps. That's kind of the only math in this chapter would be figuring out the amount of activity after a period of time. So that's the only one you'll have to worry about trying to figure out. I'm not going to make you figure out half-lives or any work backwards or any of that, just this type of organization. So the last thing, yeah, we can do that one. Yeah, we got time. Okay, so I said if you look, there's actually 2 common radioactive isotopes of iodine. So see here. So iodine has 2. So iodine 131 is the one we just talked about. We said it has a half-life of 8 days. But look at iodine 123. Iodine 123 is only 13.2 hours. That's a whole lot shorter. But both of those would end up going to the thyroid. The iodine 123, which has a shorter half-life, is used as a diagnostic isotope. So diagnostically, they will inject the patient with iodine 123, an extremely low dose. So in diagnostic, any diagnostic isotope, you want them to have a very short half-life, optimally hours, even sometimes minutes. You want a really short half-life, and you want to give them the lowest dose possible. You inject them with this diagnostic isotope, and then you monitor them on where that isotope ends up. Does all this activity cluster in one place or another? How is it distributed in the area you're trying to examine? But you want it so that it's going to tell you about the thyroid activity, but it's not going to cause any real side effects. It's really just used to help identify what's going on. So in this one, if a patient is injected with 250 millicuries of iodine 123, where it's got a half-life of 13.2 hours, how long will it take for 5 half-lives to pass? How do you figure that one out? If one half-life is 13.2 hours, what do? Yeah, you just multiply, right? So if I know one half-life is 13.2 hours, then I want to figure out how long would 5 be. So I would just multiply 13.2 times 5. That would tell me 66 hours. So it would take 66 hours for 5 half-lives to go by, okay? But you would always be given the time, you'd always be given the half-life and the number of half-lives there. So then this last one says, okay, well, how much energy is still being released after 66 hours? Well, if I started with 250, what am I going to have to do? Okay, so this is going to be half-life number 1, and it would be 125. Half-life number 2 would be 62.5. Half-life number 3, 31.25. Half-life number 4, half-life number 5. Yep. All she did on her calculator is just put in 250, divide by 2, divide by 2, divide by 2. Just make sure you keep count of how many divide by 2s you do. Every divide by 2, see how it goes down? So look at how much is left. So this is one where really short period of time, so 66 hours, that's how many days? 3 days? So basically 3 days, it's gone from 250 down to 7, okay? So that's why you'd want to use one that's diagnostic so that it's really quick in terms of that breakdown that occurs, rather than having something that's there for weeks. If I had to do the significant figures again, 250 would have 3, no, there's no decimal place, so that would just be 2. The other one I had 150 with a decimal place at the end, so that's why that 0 at the end would be important. 13.2, 3, and then I have 5. I should have had 5.0. We're going to say that's 5.0. So that would have 2. So that should be 5.0. That's the one I'll have to go back and change. So that means I'm going to keep what? So this would be 7.8 millicuries. Okay, so not terrible. So to finish this up, we're going to skip that one. Here's what you might see. So injecting a patient with iodine 123, you inject them, they sit for about 45 minutes, and in the period of time, that iodine is circulating, and it all goes and is collected in the thyroid. So your thyroid, remember I told you the thyroid, it's these two little glands, which is kind of that top picture. That's a normal looking one. So it's these two little glands, they're about this long, and they're connected by a bridge called an isthmus. So that's kind of that light blue bridge. So that comes just across, right underneath where your Adam's apple is. So you think there's a gland on either side in this little bridge. So when iodine 123 is taken up by the thyroid, it's releasing energy. So you have a detector that picks up the level of energy. That first one is colorized because now they've got the fancy computers that really show you, like, they use color to show intensity. So the more red it is, the more intense, the more blue it is, the less active. But that's pretty even, pretty uniform distribution where you can see the glands clearly. But then looking at this one down at the bottom, so I found this one as a, no, now if I can make it go away and come back in. So in this one, even though it's really dark, so normal in that one, see how they just show up as two faint kind of blobs. But then look at Graves' disease. So Graves' disease is when it's an autoimmune disease where your thyroid becomes overactive, okay? Person loses weight, has problems sleeping, has heart palpitations, sweaty all the time, and they're like, sometimes their eyes start to bulge and everything. So Graves' disease, see what happened to the thyroid. See how much darker that is, how much larger the span? So they can pick that up and go, clearly this thyroid's not behaving normally. So there's a toxic, I'm not sure what MNG, I don't know if it's manganese. I'm not sure what that is, but it's some kind of toxin exposure. So notice like one lobe looks really dark, very active, and the other one looks like it's barely there. So that shows irregular behavior, irregular activity. And then the last one, so that's an adenoma, so that's a cancer. Okay, so that one lobe has a cancerous mass in it, and the other one's not even visible. But see how dark. So that's what they're looking at. They want to see this normal. They want to see the normal, but they can then compare. So that's where the diagnostic really comes into play. If they diagnose that you do have irregular, abnormal, overactive cells within the thyroid, then they're going to give you a therapeutic dose. And a therapeutic dose is going to be that iodine 131. It has a longer half-life. So remember, iodine 123, this is hours. So within 3 days, it's really completely gone from the body. Iodine 131 has 13 days or something like that as its half-life. So it's going to last. It's going to take almost 2 weeks for half of it to disappear. In that time, that iodine 131 is releasing energy. It is, I'm not sure if it's an alpha or a beta emitter, but it's one that only releases just within that gland, so it doesn't end up affecting like other parts of the body. It's just affecting that gland. It's slowly destroying the thyroid cells. After this, or during this, it says patients may have to take precautions. So if you undergo iodine 131 treatment, they tell you to sleep by yourself, use your own shower that no one else has used, flush your toilet twice every time you use it. Why? What might you be excreting? You might in your sweat, that's why they say sleep by yourself, because you may end up having small amounts of iodine 131 in body secretions. So they tell you like that you don't you wash your dishes, cups, everything else separate that other people aren't handling, and you do this over the course of about a month. And in a month, the thyroid will basically show up like non-functional, and then you end up taking Synthroid. So Synthroid is just an artificial thyroid medication, and you have the fun job of trying to tweak that for the rest of your life, right? So like some days you're like, oh, so tired. Other days you're like, I gotta clean the house because it really affects like the overall activity, the metabolism of the body. So it's a really important gland, but if it's overactive, it'll end up burning all of your internal organs out if you don't get it under control. So that may be the issue. Like in terms of rinsing, what they just tell you to do is like you're supposed to handle your own utensils, cups, plates, like other people not handling just because of the potential. It's pretty low, but they're still say those are like wash your clothes separate from other people, like anything that might potentially have any sweat, spit, pee, poop, like any kind of excretions, any of that or secretions that you would want to limit that. Yeah, that you would want, and that's that precaution, and it's really just to make sure that nobody else in the family is exposed, just you, right? Because if they ingested any of it, where would it go? It would go to their thyroid, okay? It wouldn't like just like affect randomly, it would end up affecting their thyroid. So you want to, that's a real specific radioisotope that's used. Interesting, last couple of some other medical applications. So here we're talking about like injecting somebody with radioactive iodine. Here's some ways that have become extremely commonplace, especially during COVID, is looking at blood flow and airflow into lungs, because that is really one of the big problems that led to hospitalizations, led to people having to be on ventilators. So they can do a ventilation lung scan. So you have the patient, like you give them a tube that's hooked up to a machine, and when they inhale and hold it, they actually inhale xenon-133. And then they can take a scan, and that scan will actually show where the air is going in the lungs, so that they can show, here's normal lungs, and look at what happens if it's, do you see these areas? See like here and here? See how it's not as uniform? That shows poor air movement. So that could be an area where you have a lot of scar tissue, so the lungs are not expanding. So some COVID patients ended up with what they call glass lung. So glass lung, they got so much scar tissue that those areas of the lungs really can't expand anymore. And so that leads to long-term, almost like emphysema, long-term COPD complications in patients. But this is a way for them to actually be able to monitor and see where's the air going. So there's a ventilation lung scan, and then there's another one, this one over here. This is a technetium-99. It's the same thing that they put in smoke detectors. So technetium-99 gets injected, and this actually goes through the blood. So they can check and look at the blood vessels within the lungs. So your lungs are covered by pulmonary capillaries, this whole mesh of blood vessels that does oxygen carbon dioxide exchange with the air spaces in the lungs. So they can see areas where blood vessels have been damaged. So it's like breathing sometimes is a combination of what's going on in the lungs and then how is the vascular going on? Like, are we getting good blood flow to the lungs? Do we have good structure within the lung tissue itself? And so they can actually use radioisotopes, be able to visualize or see these rather than having to go through and doing multiple X-rays. This is sort of a shorter one, faster, better. They try to use, again, anything diagnostic, always think they're using something with the lowest possible half-life, and they try to give you the lowest dose possible. And so the detectors are really sensitive for these so that you're really not exposed to very much ionizing radiation, either as a patient or even as a person taking care of a patient that has had that. Last one. So last one is they've done they also do implants. So if you see, there's a penny. These are little titanium seeds. So they look like, if you think of the size of a penny, to me, they look like little tiny pencil lead. Like somebody took a pencil lead and broke it up. That's really about how big they are. So they can coat these titanium seeds with a radioactive substance. Usually it's an alpha decay, because remember, alpha decay doesn't go very far. And then they actually insert this seed into a tumor. So it's a way to like destroy the tumor right at the spot. Seed therapy for prostate cancer. This is a common one that's used. So the prostate is a gland that's down in the male's pelvis. The urethra runs right down through it. And most of the time, prostate cancer, if somebody has it, it doesn't end up killing them. It's super slow growing. But if they have found that there's abnormal masses within the prostate, they've gone to being able to use these seed implants. So they just put a couple of seeds and they'll actually try to determine exactly where are the most abnormal cells and set the seed right in the middle of it. And then over time, it's releasing this radiation, which then damages rapidly growing cells. And you can see that those tumors then shrink, and that can give that person like the rest of their life without having to have surgery, without having to have like a prostatectomy, which is when they surgically go in and cut out the prostate and leads to all other kinds of issues like incontinence and, you know, reproductive issues, stuff like that. So this is a good option depending on what the conditions of the tumor is. So we can do external, we can do internal by injection. You could do an internal seed implant. You could even have like inhaled types of radioisotopes for both diagnostic as well as therapeutic.
So when they do and they go in and they plant those seeds, it's so like when they do go and do the procedures, like you said, those reproductive issues later on. When they do the seeds, does that cause reproductive issues?
So sometimes you can have like, so the urethra runs right down through the middle of the prostate. So like if that seed's close to the urethral wall, sometimes people experience like painful urination, that kind of stuff because of swelling that might occur along the urethra. But usually after they're done with this treatment, after a couple months, they'll go in and take it back out. So they don't just leave it. By that time, the amount, you know, it's gone through half-life. So there's not much. So if there's any side effects, then they'll sometimes go in and remove the seeds after treatment. It really just depends on how the patient like tolerates it. Okay? All right. So this really finishes up this chapter. Yay. Okay. So in this, if you've got your exam review, okay, we've covered everything that's on the front page, guaranteed. Okay, we've talked about everything. The only thing I can tell you we didn't talk about at the end of chapter 1, we did not talk about specific heat. Okay, and I'm not going to give you any medical dosage calculation. Okay, so that's kind of like, I'd say that's about it. And then all the way down at the bottom, we didn't talk about PET scans, but that's okay. So that's just that very last one. But this one, everything, and I've got it just about finished, but there's kind of like a couple of questions per topic. You know, there's sort of major topics that we went through, states of matter, classifications of matter. Like we went through energy, some of those basic definition stuff. We did all of the math stuff, or we did balancing equations, so there's some of those. So just kind of go through, this is a good one to sort of like help you go back over your notes. And if you can answer these questions, then you should feel pretty good about this exam, like answer it without having to look it up. Like if you could just answer these questions, but do remember, like, if there's any of these that you're like, I don't know if I'm going to be able to remember the difference between, then add that to your note card. You can write as small as you want. I have seen huge amounts of information. Just make sure that it's legible for you and understandable. So it kind of requires a little bit of practice on your part getting that straight, okay? And if you need an extra one, you can take one. I don't care.
Do you have an answer for that?
No. Your notes are your answer.
Okay.
Okay.